I will first talk about the male reproductive system. Some people misunderstand the scrotum and testes as being the same thing, but this is not true. The testes are located inside of the scrotum. Sperm is produced and contained in the testes. Ejaculation is the term for when the sperm inside the testes go out of the body through the ductus deferens and urethra. The ductus deferens from the testes take the long way to the urethra in the penis. The ductus deferens moves upwards laterally. In theory, the ductus deferens will pass the inguinal canal and go into the abdominal cavity and then downwards into the urethra. The ductus deferens meets the seminal vesicle. When ejaculating, not only sperm, but also secretions of the seminal vesicle go out. This secretion from the seminal vesicle is a large part of semen. The urinary bladder changes into the urethra further downwards, and the ductus deferens will open into this urethra. Inside the prostate there is the urethra, and the ductus deferens opens up into the urethra. The male urethra is a passageway for urine and semen. In other words, the male urethra falls under the urinary system and also under the reproductive system. However, the female urethra is only a passageway for urine, so it only falls under the urinary system. When ejaculating, secretions from the prostate are also let out. Semen is a sum of sperm, secretion materials of the seminal vesicle, and secretion materials of the prostate. The urethra passes the corpus spongiosum. An erection occurs because blood fills the urethra corpus spongiosum and two corpora cavernosa. The corpus spongiosum is smaller than the corpus cavernosum, so the amount it grows is less than that of the corpus cavernosum. Therefore, there is no case in which the corpus spongiosum presses the urethra so that semen cannot come out. From now on, I will talk about the female reproductive system. This is a sectioned image of a female cadaver. In contrast to that of males, the subcutaneous tissues are thicker and the muscles are thinner. Similar to how sperm is produced in the testes, ovum is produced in the ovaries. Unlike the fact that testes are located in the scrotum, which is located outside of the abdomen, ovaries are located in the abdominal cavity. Around the ovary, you can see the urinary bladder and sigmoid colon. When an ovum is ovulated from the ovary, it follows the uterine tube and goes into the uterus. On this sectioned image, you can see the connection between the uterine tube and uterus. The uterus is at the rear of the urinary bladder and in front of the rectum. Smooth muscle is located at the wall of the uterus, and when a baby is born, it contracts. Look at how the uterus becomes the vagina further downwards. Do you see how the uterus became the vagina? The vagina is located between the urethra and anal canal. The vagina is a way for the menstruation materials to go out when menstruation occurs. Also, it is a way for the baby to go out when giving birth.